Are you feeling angry? Are you feeling low? Is it really difficult to stop worrying? Are you really feeling very irritable? You're feeling very anxious? Are you having pain in your tummy? Are you having problems with sleep? Are you having breast tenderness? Are you feeling that your body has become very heavy or swollen? Does it happen before your periods? Well, the answer is very clear. You must be knowing that I am talking about the premenstrual syndrome, a very common thing to occur in women and very commonly known as PMS. Hello, I am Dr. Preeti. Welcome to Pretty Women's Talk with Dr. Preeti. Okay, so let's see why PMS occurs. PMS occurs because of two reasons. One is the hormonal changes that happen in the uterus and the ovaries. So when the egg is released 14 days before we have our periods, after that there is a hormonal change. Another thing that happens is in our brains. That is a chemical called as serotonin that is released by our brain, and that is responsible for the happy mood. And when it is low, that may happen in the part of the period that we are talking about, then we have the emotional symptoms related to PMS. So there are two symptoms. One is physical, another one is emotional, and that is why when they mix together it really becomes difficult to overcome. Well, there's nothing to really worry about because around 40 to 50% of the women have some or the other problem related to the PMS. They may either be physical, they may be just emotional, but in around 5 to 8% of women, it can really hamper their quality of life, and these patients may require a lot of help. So how to know whether you have got PMS? Well, it's very easy. All the symptoms occur around 15 days before you start your periods, and they go off with your periods. If they remain even after your periods, then you may require help of a mental health professional. See if these mood changes or the symptoms that you have are related to any medicine that you take, whether it is related to a particular time of the day. And for that, we always recommend a diary that is to be kept for 2 months, and there you need to write down all the things that happened in a day, all your feelings. Say for example, you had a fight, so you have to write down. If say for example you're feeling very low on specific days, you have to write down. So all the emotional and the physical symptoms, they correlate when it happens in 2 cycles and it goes off when you have your periods. We can correlate that it is PMS, and